one.
Hi, I'm Lynn, and I'm here to talk to you today about dental sealants. Sealants are a preventive procedure that are placed on the chewing surface of molars. Most of the time, they're permanent. On some occasions, it's put on primary teeth as well. The reason sealants are put on your permanent teeth on the chewing surface is to prevent, hopefully, cavities. These surfaces are usually very crenated, which means that they have some pits and fissures and nooks and crannies, places where plaque and bacteria can hide. Sometimes your teeth will stain in these deep grooves, and you know if the stain can get there, that plaque and bacteria can get there, which means decay can get there. Sealants have been around for decades, and they've been proven to be safe and effective in the aid of preventing, hopefully, decay. The procedure is very simple. There's no anesthetic involved, and there's no downtime, meaning you don't have that numbness that has to wear off. I'm going to show you a workflow chart so you can see just how simple sealants can be. Once a doctor has recommended sealants for you, you'll go to the office, and I'll show you how the procedure goes from there. This tooth in box number 1 is a good example of a tooth that is a good candidate for a sealant. You can see there's stain in this tooth. The surface of the tooth has lots of nooks and crannies in it, lots of areas where plaque and bacteria can go to work and cause decay in this tooth. So this tooth is cleaned very thoroughly with some pumice to remove any plaque, any debris that might be on the tooth. You want to start with a really clean tooth surface. The next box, the second one there, shows the etchant material. This is typically blue, and it's an acid. This is placed on the tooth, and it's left on there for about 10 to 12 seconds. After that time's lapsed, it is rinsed off very thoroughly, about 10 to 12 seconds as well, maybe a bit longer. And what you want to see after the etchant has been placed on the tooth is that chalky surface. And that's how you know that the etchant has done its job. This surface provides good adhesion for the sealant, provides a good mechanical and chemical bond so that hopefully it will last. This box just demonstrates the rinsing of it. After it's rinsed, it's dried very thoroughly. I think this is the hardest part for patients as well as the clinician, is keeping the tooth dry. It's the biggest struggle that I think most people have, is keeping that tongue away and keeping it dry. Once you've accomplished that task and kept the tooth very dry, the sealant is applied. You can see that in box 4 here. The sealant material is applied. It's applied with what they call a micro brush. Looks very similar to a nail polish brush. And you brush all the areas that were etched. You can go all up and down through the nooks and crannies. You also want to be sure that there are no bubbles in this, because once it is hardened, the bubble will be a void there, and it could be a place that could allow the plaque and bacteria to permeate through. The next one shows the light that cures the sealant material. You hold the light over it. It usually has a beeping sound that goes off after 20 to 30 seconds. That indicates that that's sufficient time usually for the sealant to be hardened. The clinician will then check that area on the chewing surface there where the sealant was placed to be sure that it's hardened to their satisfaction. If it's not hard in every area, they can cure it again. Once the sealant is hard, that's as hard as it's going to be. Once it's hardened, rather, that's as hard as it's going to be. So there's no downtime. You don't have to wait to eat. Nothing. You're good to go. The last box here shows what a tooth looks like that has had a sealant placed. You can see there's no more of the stain like there is in the initial tooth picture. All the nooks and crannies are filled in. All the areas where that plaque and bacteria could seep down into the tooth and cause decay. Hopefully, this will keep this tooth from developing decay in the future. With all that being said, there is some maintenance involved on the patient's part for sealants. There are some dietary restrictions. You want to avoid hard candies, cough drops, chewing on ice, corn nuts, anything like that that could potentially break the sealant. There's also sticky, chewy things that I know a lot of kids and even adults like to eat. You don't want any Laffy Taffy, no sticky, chewy things like fruit roll-ups, milk duds, caramels, anything like that has the potential to pull a sealant out. If any of those things happen, you would know it by your 6-month checkup, because the doctor will check those sealants to be sure that they're intact. If he or she finds that they're not, the sealant can be replaced. You just go back through these steps that I showed you. Sealants are a great preventative thing. I wish they had those when I was a child. I probably could have avoided the crowns that I have today. Thank you for your time.